So today we are joined by Kinime Daniel. Kinime is the helpline manager for the Wantok Counselling Helpim line. It's a free counseling and support helpline in PNG managed by Child Fund PNG in partnership with CIMC and FSVAC. We also have Candida Kaios. I hope I'm pronouncing your name correctly. She's from the Marshall Islands. She's the program coordinator for WITO in Moa, is it? Program managed by Women United Together Marshall Islands, or WUTMI for short. Wilma, Eileen, and Hannah J, they're both with Pacific Women Support Unit. Wilma is the gender-based violence advisor for CHUK in the Federated States of Micronesia and the Marshall Islands. Hannah is Pacific Women's Gender Equality and Social Inclusion Advisor for Tonga and Nauru, and gender-based violence advisor for Tuvalu. Thank you again, everyone, for joining me online. Given Kinime is in the room with me, I'll start the conversation with you. Could you tell us about the key trends the hotline has observed over the years?
For the key trends in Wantok counseling, we've received a lot of sexual violence call and also COVID trend increase. But I'll talk more about it in the presentation as well. All right. On the issues received.
If we can have Kinime's slide up, she'll begin her presentation on the data that she's prepared for us.
Thank you, Tyler. Thank you, Toby, and the Pacific Women for this opportunity to talk more about the Wantok Counselling Helpim line. Gender-based violence in Papua New Guinea, we all know that it's referred to in PNG as family sexual violence and is a global issue. However, in PNG, it is said to be an endemic with estimated of 1/3, 2/3 of women facing physical and sexual violence in their lifetime. Violence against women is a significant an obstacle to PNG development and prosperity. Many organizations are now working to strengthen response mechanisms, which have been many steps forward in the last 5 years. Significant work has been done to address issues of GBV, still needed support. Fundamentally, PNG requires more service with increased quality, wider coverage, and integrated response system. Outside event settings, psychosocial and mental health support is extremely limited, and efforts to address GBV in rural areas remain unresourced. The Wantok Counselling Helpim line is, what is Wantok Counselling? Wantok Counselling is a partnership between Child Fund PNG, CIMC, FSVAC, and funded by New Zealand Aid program. The expanded services are supported by UNICEF and UN Women. Next slide. In 2015, the Wantok Counselling Helpim line has been launched with funding from New Zealand Government Ministry of Foreign Affairs and Trade as part of strengthening service for survivors of GBV in PNG project. The National Toll-Free Helpim line is an innovative service harnessing mobile phone technology to overcome issues of service, delivering coverage and low literacy in PNG. The helpline had received over 50,000 calls from survivors, witnesses, and perpetrators nationwide. Importantly and useful data on trends in GBV has also been collected, including presenting issues which allows child funds to undertake evidence-based advocacy with government and organizations. Also, Wantok Counseling Helpim Line, in response to COVID-19, the helpline expanded its service and became the first ever 24 hours GBV service in PNG, increasing number of counseling staffs from 9 to 22 and increased support for PSS support and mental health issues and child protection support. Wantok Counseling service for the phone call, sorry, go back to the first. As it is a national toll-free service, anyone from Digicel can call the Wantok Counseling Helpim Line, and other networks users can use by texting or missed calling, so that the counselors and the information officers can return their call to provide support to them. The service that the Wantok Counseling Helpim Line provides, next slide, sorry. Wantok Counseling Helpim Line provides the service, is comprehensive counseling, support and referral service for survivors of family and sexual violence and PSS and mental health. Counseling and crisis support given, information, crisis intervention, risk assessment. So while we are providing counseling support, in counseling support we provide crisis response, meaning that whoever is experiencing crisis, they call the Wantok Counseling Helpim Line. So while they are calling, interventions, risk assessments, and safety plans are provided for the survivors who are calling, and also referral support is provided to them. So meaning that referral, on-spot referral, calling the police if someone is in an imminent danger, calling the police and providing support, protection support to the survivors, and also providing information on where they can get the services. Mental health and psychological support provided to children and youth, parents and caregivers in such time as COVID response or anything that they are distressed about. Also, we have service provider directory, which it is managed and records of all the service providers in 22 provinces. So we have 350 service providers around Papua New Guinea. So this service directory helps to provide information to service providers to assist survivors on the ground, knowing where the services are available in the country. Counselors provide referrals too. These are the liners in GBV services: Family Sexual Violence Unit, Family Support Center, Safe House, Repatriation, Relocation, Sexual Reproductive Health, BCT and Welfare Support, Mental Health, Legal Advice, Family Planning, and face-to-face counseling. Those are services where we can refer in urban areas or where the services are, but from the remote areas, there are community leaders that referrals are made to, human rights defenders and other human rights advocates on the ground to refer survivors to. Wantok Counseling Helpim Line is seen as an entry point in terms of the referral pathway. It plays a vital role in terms of providing information to survivors of what services to access and also make referrals to. Who can call the Wantok Counseling Helpim Line? Anyone experiencing family sexual violence, psychological support, mental health, males and females or non-binary people, adults and children, anyone worried about someone else, like you're witnessing some issues and can call the Wantok Counseling Helpim line for more support. Anyone who is a perpetrator of family and sexual violence. Calls are free anyway in Papua New Guinea. The coverage, as long as digital network coverage is there, you can reach the Wantok Counseling Helpim line. Our data, Wantok Counseling Helpim line collates data for the calls that we received. Since 2015, we have received over 50,000 calls from survivors. And similarly, we have also received invalid calls. Invalid calls are calls that they hang up or they put the phones off due to power, battery, and also prank callers, abusive callers. So these 50,000 calls are valid calls, but we also receive similar calls that are invalid calls as well. So it's more likely to be 80,000 over calls. Calls received are survivors, witness, and perpetrators of GBV, male and female, close approximately. We've seen that perpetrators are lower than, but the issue that we have is we don't have services that we could refer perpetrators to in terms of support, but we provide counseling support for them. 70% of presenting issues are GBV related, IPV, child abuse, sexual violence. So we've seen that an increased call in IPV and child sexual abuse cases. We have seen spike in calls in May 2020 around the lockdown in PNG, and since COVID, COVID-19 helpline has seen a 75 increase in calls. We've also made data to see the calls before COVID, after COVID, to assess the increase in terms of the call and the distress. So people call in due to job losses, due to COVID information and the pressure. So this has seen a quite increase in around COVID, in times of COVID, yeah. 128% increase in calls from 11 to 15, and 150 increase from 16 to 20 years old. And we've seen in these times that youths has an increased number of calls, and also mental health calls increased by 263%. So sexual violence, family violence, safety issue, and IPV increased significantly in this during COVID. 60% of increase in harmful traditional practice related to calls, including sorcery accusation related violence, due to stigma and other discrimination attached to sorcery accusation. It has increased the number of SRV cases. Also, we collect data from provinces to see which provinces are calling to the helpline, and we've seen a large increase in diverse range of regions. The calls that increase are calls from Hela, Gulf, Western, Southern Highlands, Morobe during the COVID period. As Wantok Counseling is also collecting real-time data, we are also circulating quarterly data reports to our partners who can use to provide support. And also we've unpacked our data in about thematic briefs on intimate partner violence and sexual abuse, and also COVID-19, and we have them available. We also launching 2-year operational report. We are also happy to circulate reports if any partners who are willing to, then they can get back to me so I can, we can provide quarterly report, and also the reports are available. If you want them, we can circulate it to them as well. It's finished now, the last one. Yes. Yeah, thank you, and thank you for presenting this.
Thank you, Kinime. That was such an insightful presentation. It gives us an idea of the number of calls that you're fielding every day. And I know that the counselors are working 24 hours now. So that's a huge amount of work that you're doing as well. So thank you for that. We'll cross over to Candida. Yakwe Candida. I understand that your organization has pivoted to telephone counseling. Could you tell us more about your experience and challenges providing a telephone counseling service in the Marshall Islands?
Thank you. Thank you, Pacific Women. Before I will proceed and share my experience on telephone counseling, I would like to take this opportunity and give us our warmest thank you and kumokaka to your support. So first off, I would start with I would like to share a little bit history of WUTMI so we can understand how WUTMI started. So WUTMI is an organization of women chapter in 18 local jurisdictions, and WUTMI was established in 1987. So it was way back, and WUTMI executive board made up of funding members, officers, and president. They met every year, twice every year. So because most of the members of the WUTMI executive board sit in many of the government boards, it was easy for them to discuss every twice a year issues that women and girls are experiencing in the Marshall Islands, and then they take it to the corporate so the government can discuss their issues. So this was how women were, their issues were raised to the government. So WUTMI's goals and objectives are to strengthen knowledge and practice of Manwin Majo or Marshallese culture, and to strengthen and preserve their indigenous and natural resources. Also promote capacity building and develop and sustainable development. WUTMI goals and objectives are also advance good governance and human rights. That's where Weathermore falls under. And last one is to strengthen the voice of women through a structurally stronger WUTMI organization. So WUTMI started as one small office. In 2002, WUTMI opened its own office, and it was a really small one. And they have no money at that time, and they have one volunteer that was appointed, Australian volunteer that was appointed to assist with the office management. And the rental was donated from two of the paramount chiefs here in the Marshall Islands. In 2003, now the organization has been able to finance its administration and its programming. So prior to Wydon Mode, since 2003 to present, now WUTMI was able to finance its administration and programming. And prior to Wydon Mode, there were others programs and projects that promote public awareness about domestic violence. So it was in 2016 that Wydon Mode was the lounge. So we started with only three of us, three counselors, which we didn't know. We have no experience on and knowledge about violence against women, about counseling, or what, and everything. We were like, to scale us from 0 to 10, we were at 0 at that moment. So we had an advisor. She was an Australian, and she was funded by, if I'm correct, by DFAT, if I remember that right. So WUTMI was established then, and we were trained from that, our counselor advisor, and through those here, we gain our knowledge and experiencing on providing and increasing our knowledge and understanding about women issue, especially violence against women and girls, here in the Marshall Islands. Here in the Marshall Island, there is about more than 50% of the women here that have a partner or husband or boyfriend have experiencing violence, more than one form of violence. So right now we are a team of 8, and our program have expanded to one of the outer islands here, which is Ibai Atoll. So we have now 2 branches, one here on Madro and one over at Ibai. So before we didn't have a telephone counseling. It was just last year that we were trained to have telephone counseling. We have this phone that we could access, that women can call us after hours and in the weekends, but we weren't trained for telephone counseling. Not until last year of July, we had this training, telephone counseling. So before we didn't really understand that telephone counseling is very different from face-to-face counseling. So during that training, it was a good opportunity because it was a refresher for our staff, our counselor staff, and also an opportunity to learn new skills. So after that, because telephone, it was myself and 2 other counselors that participated in this training. So after the training, we understand more about the differences between face-to-face counseling and telephone counseling. So after that, we've received more than, last year, we've received more than 10 phone calls. And we received those phone calls during weekends, after hours, and even weekdays. Some of the challenges are that, when we have poor signals. So if we have poor signals, we cannot reach women that cannot come to our services. So that is one of our challenges here, but not every time. It's only when times that when our national telecommunication have issues with their TAMA, or what do we call it, solar satellite. Other challenges are we don't have privacy. When offering counseling at our homes at the weekends or during after hours, privacy is a challenge because we have our family, we are with our families. However, we have sit with them and explain them about our confidentiality, the work we are doing. Other challenges are women from the outer islands. So we have recruited women from the outer islands so they can be our referral pathways. However, it is a challenge also because not every outer islands have our access to cell phone or telephone. So if the head toll doesn't have the, what do we call that? They are not allowed to use cell phones because there are only 4 islands that I know about that use they access to cell phone easily. But the other islands they have to go to the council house. So they have the council house in each atoll where they have communication devices. They have the telephone line and they have the, what do you call that? The radio, CP, outer island radio, CP radio, where they do their communication with other islands and atolls in the Marshall Islands. So that's another thing that is a challenge and issue because there's no privacy and there's no confidentiality.
Thank you, Candida.
So
Thank you for that. I'm sure telephone signals is an issue that all of the Pacific Island, everyone in the region has had. So thank you for bringing that up. We'll cross over to Wilma and Hannah. As I previously mentioned, Pacific Women Program has been developing several information, knowledge and management system products, and one of those products is the telephone counseling toolkit for GBV survivors. Wilma and Hannah and other advisors have been working with our partners across the region to develop this telephone counseling toolkit. And we'll have a chance to have a preview of the toolkit in the second part of the session. But firstly, Wilma and Hannah, could you talk through the counseling toolkit with us, please? Thank you.
Hola Vinaka, everyone. Thank you for joining us at this time. So just to give you a little bit more information with regards to the development of our toolkit. So what actually happened is because of this whole COVID-19 pandemic and the importance of the to continue to provide counseling to survivors of violence against women, it was important for us to work together with Candy's team as well as TICC to develop a telephone counseling toolkit, noting that Candy has mentioned that they did provide that counseling avenue for women to reach out to WUTMI, but they had very little knowledge around the skills or how to, provide telephone counseling sensitively, taking into consideration the do no harm principles in this area of work. So the toolkit was is to train GBV counselors who are already providing this service to further develop their counseling skills in telephone counseling. There will be a TOT approach, and materials are designed to be delivered by experienced or GBV counselors within crisis centers. So what happened is, as we mentioned earlier, it was developed for preparedness to continue to provide counseling to survivors of violence against women as part of the evolving response to COVID-19 pandemic, and also the shift to provide remote service and the delivery of GBV counseling over the phone, as well as to respond to other humanitarian crises. So what happened is we sent out survey questions to Chuk Women's Council. They provide counseling service. They're very new. They were just opened last year in March. So as Candy mentioned as well, the counselors were very new into this area of work. So we sent out the survey questions to Chuk Women's Council in Chuk State, as well as to Candy and her team. So as a result of these survey questions, Pacific Women Advisors developed 6 modules, a training package around telephone counseling. So our first pilot training, of course, was with CWC counselors as well as Candy and her team. The training package was further refined after our second piloting, which we delivered in the Solomon Islands, Vanuatu, as well as in Tonga. So, you know, these crisis centers are part of the Fiji Women's Crisis Center Pacific Network Against Violence Against Women. So when we delivered this training to the crisis centers in the North as well as in the South Pacific, the sharing of learning and reflections from these counselors, you know, Pacific women advisors were able to further develop the materials contained in this Pacific Toolkit. Thanks, Hannah.
Thanks, Wilma. As Wilma was saying, the initial 6 modules were expanded to 8 based on the feedback and learnings that came from the pilot trainings. So the toolkit itself has 8 modules and each lasts between 1 hour and 2.5 hours. And the toolkit is really designed to either be delivered continuously over a 3-day period or in regular sessions over a longer period, recognizing the need for flexibilities within crisis centers that are still continuing to provide a service and need to be available to clients, to respond to clients as well. So the 8 modules that are in the toolkit, they begin with preparing for telephone counselling. So developing skills on how to begin a call, including introducing yourself and your service and obtaining informed consent. We then move on to module 2, which is focused on conducting risk assessments over the phone and really examining the differences between in-person counselling and risk assessments, you know, phone-based counselling. Module 3 covers safety planning, again, really focusing on building on those existing safety planning skills that counsellors have and practicing how safety planning might be different when in a phone-based situation, you're not controlling that physical space where the client is, you know, currently at that moment, and you might have to think more through about their safety in that existing moment while you're doing the safety planning with them. Module 4 then looks at more broadly at practicing different counselling skills in a telephone counselling setting. So micro counselling skills, building trust and rapport with a client over the phone, making referrals through telephone counselling, and importantly, how to safely close a telephone counselling call with your client. And really, again, it's emphasising the differences in providing counselling for GBV survivors over the phone. Module 5 is focused on documentation and data storage, and it's thinking about what are the risks associated with documentation and case notes when you're working from perhaps a home-based environment. And we've heard some of the challenges there from Candy around working from home, trying to get privacy to be able to conduct your telephone counselling. So that's the focus really of that module, as well as looking at, you know, what might be the challenges of trying to have a phone call and take case notes at the same time when it is safe to do so. Module 6 is focused on supervision and self-care. And again, it's strongly focused on the context of remote working and challenges to supervision and self-care in disaster-affected contexts when there has been a disaster, either COVID-19 or other crises. Module 7 and Module 7 and Module 8 are the 2 new modules that came about as a result of the feedback from Candy's team and from other crisis centres. And Module 7 is focused on understanding or managing a call with a child, really understanding the ways in which a child might interact with the GBV helpline or 24-hour line, and in building the skills of counsellors to be able to confidently make referrals and communicate with that child when they call. So for example, the module covers testing calls And there's practice sessions there on how to respond to a child who might be calling the line to test whether there's a safe person who will listen to them on the other end first before they're willing to speak. Module 8 then looks at text and chat, which was really strongly recognised as an important avenue for communication to crisis centres in the Pacific. And we saw more and more from the crisis centres during the training that they were reporting clients who were contacting them over Facebook chat or over message. Because of the COVID-19 pandemic and associated lockdowns, but we were also hearing from them that they had clients contacting them from overseas as well, who were perhaps expats and wanting a culturally appropriate and safe service for them that they weren't able to access in other environments. So the module 8 is really not focused on providing extensive counselling through chat, but really focused on that response and then referral to other counselling mechanisms. And that was really based on the learnings from the pilot. Each module itself follows a set format where it starts with information and discussion, then goes to skills demonstration and observation skills for the counsellors. And then every module has a core part at the end, which is skills practice and a strong focus on experiential learning. I'll hand over to Wilma for the next section.
Yeah, thanks, Hannah. So we have audio recordings as well to demonstrate the skills that we talk about in this toolkit. So there are a few audio recordings, for example, how do you respond to a client who is at immediate risk, safety planning over the phone, managing a call with a child or an adolescent, and as well as to demonstrate the telephone counseling skills. Yeah? So we have one audio recording that we would like to share with you today. Just a bit of a, how shall I say it? It might stir some feelings within you, it might, you might think about your own personal experience as well as that of a family member or a colleague. So please, we'd like to, give you that warning before we play the audio. So thank you, Spider, for playing the audio. Vinaka, Spider.
The recording is a demonstration of a telephone counselling call. This is not a real call and is voiced by actors. The recording contains telephone counselling case scenarios and may discuss incidents of gender-based violence. You may find the content distressing. If you would like to speak to someone, reach out to your supervisor, contact your local Women's Crisis Centre or Gender-Based Violence Helpline. The number for Women's Crisis Centres and helplines in the Pacific are listed in the accompanying toolkit. Hello, you've called the Women and Children's Crisis Centre. This is Hannah.
Hi, Hannah. This is Sandra. My husband just punched me up on my side. I am here with my children. Please help me, Hannah.
Okay, Sandra, it sounds like you're in a bit of a difficult situation. Are you safe right now where you are?
I'm not sure. I can't see him nor hear him, but I really need your help, Hannah.
Okay. Can you tell me where you are, Sandra?
I'm at home. I'm at home with my 3 kids.
Okay. And your husband? You're not sure where he is at the moment?
No, I don't know, but he could come back at any time, Hannah.
Okay, Sandra, it sounds like you might not be safe there. Would it be okay if I call the police to come and assist you?
Yes, please, if you can.
Okay.
Can you call them straight away, please?
Will do. Can you just tell me where your house is?
My house is beside a temple. We're on Kaunitoni Street. Please hurry, Hannah, call the police.
Okay, I'm calling the police now.
Thank you, Spider, for helping us, play that audio. So this is just one of the audios we'd like to showcase to you. It's one of the many that's part of this toolkit. So, you know, as our sister already mentioned from the PNG, the importance of providing the crisis centers a diary or to check out the crisis center helplines. So this is also included in our toolkit, our Pacific toolkit, as an annex at the end of the toolkit. Binaka Hannah.
Thanks, Wilma. And maybe just to add on to the audio that there are notes within the toolkit for the facilitator to safely facilitate that session and to have a discussion around it. The other component that I mentioned before of the toolkit is, and really the toolkit has a strong focus on experiential learning, and there are many role plays throughout the toolkit. So during the pilot training, we really felt that the role plays and the chance to practice the skills were incredibly important to the counsellors. And we've built this into the toolkit. So the role plays, again, have a focus on specific skills that would be used during telephone counselling. Examples include conducting risk assessments. And so for that role play, you would have the counsellors perhaps sit back to back so that they can't see each other. They can't see any facial expressions or body language. And then you can try and simulate a situation where you're not controlling that physical space again, and you've got to be able to safely and quickly conduct that risk assessment. There's other experiential learning activities throughout the toolkit that focus on, practicing communication over chat with survivors who might be contacting the centre, or, for example, safely and accurately taking those case notes from a live counselling session over the phone. We've also included throughout the toolkit a number of illustrations that are designed for the most part to really provide quick visual representations for the facilitator. So on that last slide, I'm not sure if you can see it, there's an example of the illustration showing the facilitator how they might set up the room and also monitor that role play with the counsellors sitting back to back and simulating a phone call. So we've tried to include those visual representations throughout so that facilitators can, quickly pick up and easily navigate and understand the activities that, thank you for sharing, and the room setup that they will have to do in terms of facilitating the training through the toolkit. So that's all from us, unless there's anything, Wilma, you wanted to add?
Just one last bit. So, this whole toolkit, we're teaching a new skill. And as facilitators, the importance of demonstrating the new skill taught, as well as the, allowing the participants to put into practice or apply these new skills taught, yeah? So it's all about that, learning, doing, demonstrating, doing, and, allowing facilitators as well as participants to make mistakes and to identify those mistakes and talk about those mistakes and how we can improve, ensuring we're doing no further harm to our survivors of violence against women. So facilitating the development of new skills taught and learned is so important, and it's part of this toolkit. Vinaka.
Thank you, Hannah and Wilma. Thank you, Hannah and Wilma. It's such a good toolkit. So once I think the support unit, the next session, we're going to have a little preview of the toolkit so you can all have a look at how it looks like. So we're going to enter into our question and answer time. If there's any questions that you would like to ask, please write them down on the text, on the chat box, and then I can ask the questions for you. But otherwise, I can start first. I think for me, I'd like to know for Kinime and Candida, for people with disabilities, how can they access telephone counseling services? Kinime and then Candida can add in.
Thank you. That was a good question. It's quite challenging to reach out to people with disability in terms of telephone, but reaching out for them to reach out to telephone counseling, we receive witness calling in on behalf of them of the issues that they are facing, and we help them through their guidance or the witness that they are calling in. Those that who can speak, like limbs and they can talk, we assist them, and we do records of data as well for the assistance given to them. But we encourage as much as possible to people who are guardians or witness can call on their behalf.
Thank you, Kinime. Candida, would you like to add?
Yes, thank you. So, yes, that's a very a challenging thing. So, for this people with disability, like for example, the people with mental issue, so we have one referral, and the mom at the call for her, and also for people that cannot have mobility issues. So I think the telephone counseling will be much easier for them. But if they don't have the phone, we will always provide the phone for them. For mute person, if a person would call on their behalf, then because we don't have a counselor that can communicate with this kind with mute person, so we have people that we know and we are partnering with. We have already talked with them. However, we have not established an MOU yet, but in the future we will. So we will have to contact them so they can like the translator.
Thank you, Candida. Maybe Hannah and Wilma can also answer that from the toolkit perspective.
Yeah, thank you. It was something that came up in the discussions with the training and the crisis centres, and as Candida, I think, was also reflecting, there was some reflections that the telephone counselling can be more available to some women and girls with disabilities than traditional in-person counselling. Those that might have mobility issues or have restrictions on are restricted in their ability to leave the house and move about. Particularly, I think, for those that want to contact the crisis centre without the knowledge of their carer, telephone counselling may provide an opportunity to do that. I think Candy has also alluded that I guess it's also a case-to-case basis, and that telephone counselling won't be accessible for all women and girls with disabilities, but that having also the chat and text function for initial communication and as an option to set up maybe in-person counselling could also be a way to make it more accessible for some women and girls with disabilities. I'm not sure, Wilma, if you wanted to add anything to that.
No, that's all good, Hannah. Thank you, Hannah and Candida.
Sorry, and to Candida and Kinime, I'd like to also ask, because I don't have a counseling background, and we've always known counseling to be a face-to-face experience, but with current COVID-19 restrictions, telephone counseling is probably the best way to go now. Can you tell us what is one difference between face-to-face counseling and telephone counseling?
The similarities in terms of using the counseling skills, but one disadvantage and advantage of counseling, face-to-face counseling, is when you have that space and a survivor is coming in to talk to you, and as a service provider you have that control, but over the phone you don't have that control because the survivor has the control and can end the call anytime. And that is the risk. So building proper rapport, and because that one call is the most important call, and it's treated as very important because anytime the call can be terminated. So building very good rapport, having appropriate skills to build and assist the client is very important. And going back to the toolkit that was created and that audio played was really a bit, going line, and it was really helpful as well. Having the skills, right, appropriate skills in terms of telephone counseling is very much needed.
Thank you, Kinime. Candida, would you like to add?
Yes, thank you. So differences between telephone counseling and face-to-face counseling is, one is that face-to-face, while in a phone call, we are not aware of the surrounding and we cannot read their facial expression and their body language. And in telephone counseling, it's very different. You have to be more cautious and you have to listen carefully. So you have to listen for the tone, the volume, and also for the sound of the backgrounds. And in telephone counseling, as mentioned earlier, it's like all about safety planning. You have to make sure if the person is safe where she is at the moment.
Thank you, Candida and Kinime. Thank you, ladies, for joining me. That's the end of our panel discussion, but we're going to go on to our second session, which is a preview of the toolkit that Hannah and Wilma were sharing with us. So I'll cross over to Lai and Tara in Suva.
Good evening, everyone. Welcome to be here in Suva, connecting all the way from Suva. And it is an important occasion just to do a short preview of what the toolkit looks like. But before that, I would like to invite the partnership lead for the Pacific Women Support Unit, Tara Chetty, for her formal speech.
Thanks very much, Lai, and thanks so much, Torvi, and all the partners for giving us this space for this exciting preview. I just wanted to share a little bit of a background before those who've been working on the toolkit share it with you. So you heard from Wilma and Candida and Hannah about where this toolkit emerged from. And it really emerged from that moment of need in the sudden outbreak of COVID-19, the lockdowns that were coming across the region, and new and emerging centers in the North Pacific trying to think through ways that they could still serve their clients during these times of crisis. And the Pacific, as we know right now, they're discussing climate change elsewhere in the world, which affects us the most, is rocked by crisis from time to time. So these skills are crucial and handy for our partners at any time. I just wanted to give you a little bit of background because the Pacific Women Program, which has been running for almost 10 years, is now commencing its wind-up phase. It will be winding up and transitioning into the next round of programming. At the regional level, that's already been announced, and it's called Pacific Women Lead. But as we wrap up one program and move into the next, we want to make sure that we're capturing all the experience that people like Candida, Hannah, Wilma, and Kinime bring to the program and bring to the lives of the women and girls that they serve. And so we're pulling together a number of knowledge products to help share and summarize and really capture what have been some of those key learnings about gender transformative approaches, or really specific ways of doing things. And this specific toolkit for telephone counselling for survivors of GBV is the first one. And we're really excited to be able to share this preview with you. There are a few thanks that we need to make as we do this. It is something that has been developed over time and refined with the input of service providers working across the region in really different contexts, from the Solomon Islands, Vanuatu, Tonga, and of course, our sisters in the North Pacific. So we would particularly like to thank Women United Together Marshall Islands, WUTMI, and Canada's program there for their co-development of this toolkit. We would like to thank the TICC counselling service run by the Chuk Women's Council in the Federated States of Micronesia. And we'd like to thank Tonga's Women and Children's Crisis Centre as the three leading centres to help co-develop this product. And it was done by a number of wonderful advisors that work on the program as well, who supported the partners in developing this toolkit. So Wilma and Hannah, you've already met today, who've been part of it. There were also Sonali Owen, who's been working closely with partners in FSM, and Georgina Gilbraith, who worked with partners in Nauru. So behind the scenes, there was also a wonderful dynamic working group with Lai himself here, who is helping to drive and pull together all these different things, including those really powerful audio clips that we just heard. And every time I do hear one, this is the second different one that I've heard today, they really hit you right right in your core, you know, and you get a sense of what women are going through and what the counsellors who provide this service over the phone, as Kinime said, with very little control over what's happening on the other end, trying to keep the situation calm and provide some response to what these women and children are going through. So I find those really powerful, but they're just one part of this toolkit. So I'll stop talking now and say thank you once again to our colleagues at the Papua New Guinea Support Unit, to all the partners who have contributed, and hand over to Lai for a bit of a preview. Thanks so much for joining us in this. Vinaka.
Lai, you're on mute.
My apologies. So as Tara had mentioned, so this is what the toolkit looks like. Once it will be able to finalize this, so the next step towards the process is we'll be carrying out a regional training of trainers, and this will be done on the 15th of November. So we have already decided the number of crisis centers, counselors who we have been trained early, and we wanted to retrain them again on this new toolkit. And these trainees, once they are well certified with this, well versed with the toolkit, they are the ones who's going to continue with the implementation of the training, especially the three crisis centers that Tara had mentioned, which is WUTMI, TICC, and WCCC. So this is just a short preview of what the toolkit looks like. If you're able to see on my screen. And those are the content in which the team has already represented. And most importantly, what we have also included in the annex, which is all the context for for available services that we have across the Pacific. So that is all we have for the preview. As I said, watch this space as we are able to, once we have the training of trainers carried out. If you're able to reach out to your partners with the invitation, feel free to accept and come with us through this journey of the first telephone counseling toolkit here within the Pacific. Thank you so much. Now we'll open up the space for any questions regarding the new toolkit. Vinaka.
Thank you, Lai and Tara. Thank you to Kinime, Candida, Hannah, Wilma, Tara, and Lain, Sova for joining us today. And thank you to everyone else that also logged in this morning to join us for this counseling or telephone counseling services learning session. I'd like to just reiterate that the number for the helpline in PNG is 7150-8000, and it's a toll-free line for anyone who wants to access the number. Thank you so much. Again, if you have any questions or any lead-up comments, send an email to administration@pacificwomen.org.fj, and we can forward your comments or your questions to the panel. Or for the toolkit, you can send us an email as well. So the email address again is administration@pacificwomen.org.fj. Thank you everyone for your time, and that's a wrap for this learning session. We'll let you all know when our next learning session is. Thank you, and Vinaka everyone.